Thank you. Okay, we are live. Good afternoon, everybody. I'm Delegate Pam Gazzoni, and you are tuned into the Health Facilities Subcommittee of the Health Committee. We have 4 bills that we're going to look at today. If you have an agenda, I can give you the order. We're going to start with HB 1563 and then go to HB 1087, then to HB 1002 and HB 965, depending on how our timing is going. So I'm going to start with HB 56 and Lindsay.
So HB 1563, as introduced, would have prohibited certain policies and contracts issued by an insurer, nonprofit health service plan, or health maintenance organization from denying a covered emergency room service solely on the basis that the insured or enrollee did not experience an emergency medical condition. The bill also requires the insurance commissioner to include specified data on post-acute services in the annual summary report on carrier appeals and grievances. By January 1st, 2027, the Healthcare Commission, in conjunction with the HFCRC, must conduct 2 studies. The first to quantify bed capacity in hospitals and post-acute settings.
Enter your meeting ID.
And recommend a collection and auditing process for bed reporting. And the second to analyze options to facilitate clinically appropriate transitions from acute to post-acute care settings. The amendments circulated.
Enter your participant ID followed by #.
Strike provisions prohibiting denial of covered emergency room services.
Allison, you're not muted.
Yep, there we go.
And instead authorize the insurance commissioner to conduct an examination of a carrier that has issued a pattern of adverse decisions or grievance decisions for a claim or authorization request for services in or related to services in an emergency department. And it authorizes the commissioner to have an adverse decision or a grievance decision independently reviewed, and adds a requirement that the MHCC studies be conducted in consultation with representatives from the post-acute care industry.
Thank you. Erin Hopwood is here from the Speaker's Office. Erin, would you have any comments for us?
Lindsay described it perfectly. I will say that the issue at the hearing with the bill was the prohibition on carriers from denying a covered emergency room service solely on the basis that the enrollee did not experience an emergency medical condition. That language has been struck from the bill and instead replaces it with the authority of the MIA to examine carriers that have shown a pattern of adverse decisions based on emergency medical conditions. And I believe, and they are on the call, the carriers are okay and the hospitals are okay with this amendment.
Move the amendments.
Do I have a second?
Second.
Thank you. We have a second. Any other discussion or questions, concerns on the amendments? Delegate Alston? Okay, your hand's up. Thank you. Okay. Seeing no other hands, let's go ahead and vote on the amendments, please.
Move the amendments.
Thank you. I think we had a second already.
Yes, second. I gave you a second.
Thank you. All in favor?
Aye.
Any opposed? Okay. Moving forward, go ahead, Delegate.
Second.
We've moved the bill and seconded the bill. Any additional comments, questions, concerns? If not, all in favor?
Aye.
Aye.
Any opposed? Please raise your hand, your yellow hand, your digital hand. Seeing none, bill passes. And we can move on to bill number 2, HB 1087. Lindsay, can you help us with this one?
This bill requires each healthcare facility that performs surgical procedures to adopt and implement policies by January 1st, 2028 that require the use of a smoke evacuation system during a surgical procedure that may generate surgical smoke. There are no amendments.
Oh, good.
Is anybody here to speak on this bill? Questions, concerns, discussions, comments?
Move the bill.
Second.
Okay, the bill has been moved and seconded. All in favor?
Aye.
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 Any opposed? I saw some, it's Delegate
Yes.
Schlega, you're opposed?
No, I just wanted
Okay.
to ask you,
Sure.
where did the hospital association come in on this?
Christy Wheeler, do you have a response on that?
I do. They are not opposing us.
Thank
Right.
you.
Andrew Nicholas here for the Hospital Association. We did not oppose.
Thank you. I'm not opposed. I was trying to ask a question.
Sure, that's fine. Okay, so everybody, so no opposition to this bill? Okay, that one passes unanimously. I was hoping that we were going to take just a little bit more time so that Delegate Lopez would be able to join us. Is Emily, her chief of staff, on?
Yes, I am.
How's she doing on her side?
They're still going.
Okay, okay.
I think Delegate Warman's here.
Yes,
I have a quick question. Chair,
certainly.
what was the bill I missed that you moved
Sure.
before I got on the call?
Sure, it was HB 1563, Emergency Room Services and Post-Acute Care Coverage and Facility Studies. So it was a speaker's bill.
Okay,
There were a couple amendments which were passed, and it was unanimous.
all right. Does it still have a fiscal note?
It does, I believe, but and Lindsay can comment on this.
Well, the bulk of the fiscal note was as a result of the requirement to cover the emergency room services, and that part was amended out of the bill.
Okay, I'll look at it. Thank you.
Okay, so on HB 965, I'll share where we are on that, and I know this one has been going around for a little bit. As you may remember, last week there was a new amendment that had been added by the chair. The Department of Health wanted to have some time to look at that. I was in touch with them last night, and we're looking to be able to do a work group on several of the nursing home bills that are related to each other. Department of Health needed just a little bit more time, and we're going to try to get the work group going on that in just a day or two. So I think that we are going to put 965 on hold yet again to see what we can do with regard to this work group that the MAH has asked us, Maryland Department of Health has asked us to work with them on. So I'm going to pause and check with Emily again from Delegate Lopez's office.
They're just finishing up the last bill in elder and long-term care right now. If you would like me, we can go over the current situation, and then she can come in and give her
Sure. But what I wanted to do actually was let Ms. Kaufman talk with us, because she was unable to be at our meeting last week because she was on a different subcommittee. And I know she wanted to be able to share some thoughts on the bill.
Thank you very much, Delegate Gazzoni. So our biggest concern right now with this bill is the language that is on the bottom of page 5 and the top of page 6 that requires, or basically resets, the discharge timeframe for 30 days. And I know that there has been conversations regarding the state operations manual and the fact that the state operations manual says 30 days in its interpretation. The federal requirements are 30 days or as soon as practical under certain provisions. And I also just wanted to step back and just reaffirm the fact that involuntary discharges are very difficult, and they are only allowed under 6 very specific circumstances, which are both in Maryland law as well as in the federal regulations. Where our concern is the way this bill is drafted at the end, any change in the notice, even minor, will reset the clock by 30 days and then require a second set of appeal rights. Now, the federal regulations, when you take a look, and the state operational manual qualifies that 30 days with a significant change to the notice. Unfortunately, the Fed stopped short and didn't define significant change. It gave an example of a change in destination or location, but that's it. So the way this bill would read right now in practical terms, let's say that another nursing facility will accept that patient, and the discharge notice says that the transfer will occur on March 15th. But on March 15th or a couple days beforehand, the nursing facility says that they can't accept that patient on the 15th, but then they can accept that patient on the 18th. And that could be for a variety of reasons. It's very hard sometimes to hold a bed. And frankly, our staffing can also negate when a patient can move in. But under that scenario, even though it technically is changing the notice, so it would prompt another 30 days, but the notice may only be because the discharge is being moved 5 days. So we're really concerned about that, because this language as it is will be basically any type of change, even if it would be like the social worker who does the discharge planning. If their name changes, that could actually then require another notice and 30 days. And that, we believe, would be inconsistent with the federal regulations and state operational manual, because again, that refers to a significant change. Consistency is very, very important. When you don't have consistency between state law and federal regulations, that is when you get compliance issues. So we are trying to be very careful. My recommendation is, given the fact that we do have federal regulations on this, is simply to remove the lines on 28 through down to 30, and then the top of 6. And that would still preserve, and again, this would be a change with federal regulations, but we agree with it, that every resident would get this notice, even those who haven't been in the nursing facility for 30 or more days. And again, that's a change in the federal reg. So again, we're just trying to have some consistency. And we do fear that with that change on page 5, a nursing facility will never be able to involuntarily discharge. And there are significant reasons why, as stated, that may need to happen.
Chair, I do have a response to that, if I'm allowed.
Sure.
So in the situation that Dana described, the bill also explains that the incoming facility has an extra 7 days to find a bed outside of the 30 days. So in her situation, there are leeway for the fact that a bed might not be available on day 30. So there are 7 extra days for an incoming facility to find a bed, and the resident would be staying at the current facility until that bed is available. The only situation where this would come up and the location would change is if that incoming facility says that they no longer can take the person at all, but they've got 7 days outside of the 30-day window to find a bed. So they know that the person that the 30-day window is up, and then they've got an additional 7 days. So in that particular situation, that wouldn't need to have a new issuing of anything, because the 7 days are built into it, and therefore a new notice wouldn't be sent. But also, if we're talking about consistency across regulations, the 30 days is mentioned specifically, and yes, it is relation to significant change. If we wanted to have parallel regulations, adding significant change per the federal regulations might be agreeable, but the 30 days would also need to be mirrored as well, because that is also in the regs. So if we're talking about regs being parallel with each other and not contradicting each other, then the 30-day reset is in regs, and therefore we want to keep that as well. So that's just my response to those specific instances.
Thanks. Delegate Szeliga.
Thank you. Where is the 7-day? Is it in the bill? Is it new language or existing?
It would be new. It would be new language.
Okay, where does it say that? I don't see it. That's why I'm asking.
Okay, well, it was always intended to be there. I'm not sure when it ever came out, but that was always in the discussion, and it was also in our testimony originally.
Yeah,
as
I don't see
required.
it in here unless I'm missing it, but then that would be important to be in there. But
I mean, it was definitely intended, and that is something we can make sure is added, because it was always intended to have the 30-day leeway, because the whole point is that an incoming facility does acknowledge that they are going to be the incoming facility, and that has to happen before a discharge notice is issued in the first place. So we did want to give some leeway to the dates, because we do understand that they're not going to hold a bed necessarily. So that was always intended. I'm sorry that it's not in there now, but it was definitely in our testimony originally.
and
Also,
then-
now going to defer to Delegate Lopez going forward.
okay,
Yeah,
and
I'm trying to catch up here, so just give me some grace as I listen into comments and figure out where we're at.
okay, additionally, I'm just worried if it's an involuntary discharge. So the person doesn't want to leave. And then with the language, the way that Dana talked about it, could the resident that doesn't want to leave then just use that as an excuse to stay for another 30 days? I mean, it's got to be very difficult when there's an involuntary discharge.
The change in the discharge would be coming from the facility, not from the resident. The resident is giving 30 days to appeal. And then if a new discharge notice is issued with additional or changed information, that's what would indicate a new appeals timeline. It doesn't come from the resident themselves.
Dana Kaufman?
Yes, well, and thank you, Delegate Shalega, because I did not see the 7 days either in here. So that was one of my questions. But I think that also makes my point too, with the comment about changing and adding in significant change, is that the federal regulations and the state operations manual, which is used by surveyors, already contains language on when a resident needs another notice and additional appeal rights. So I think that we're starting to get to the point that we're going to create a lot of confusion. And that is why I was recommending that, the crux of this bill, it was my understanding, was also to ensure that every resident got the notice, which we agree with, and that the receiving facility accepts responsibility and discharge, which we agree with. So the two main points we agree with, but it is, to your point, extremely difficult. And you have to also recognize that when an involuntary discharge is being done, the circumstances are basically that the transfer or discharge is necessary for the resident's welfare because the resident's needs cannot be met in the facility. The transfer or discharge is appropriate because the resident's health has improved sufficiently, so they no longer qualify for nursing home care. The health or safety of an individual in a facility is endangered, which includes our staff, or prompt payment. Well, I'm sorry, there's no payment happening, and then if the facility ceases to operate. So it is a very limited set of circumstances, and luckily one that does not occur frequently. But to your point, Delegate Shalega, if we make this so difficult that 30-day window is constantly repeating because either the date changes or something also changes, we're just concerned that it will also limit the nursing facilities who may stop taking a resident that might be a little, that they might have a concern with whether or not they can take care of that individual. So they kind of do it almost on a trial basis from the hospital. So that is our point. And again, we agree with most of this bill. It's just that provision, which is already included in the federal regs. So we're asking that it be removed.
So Delegate Shalega, did you have another comment, or your hand's just still up?
Sorry, hand's still up. Thank you.
No worries. Delegate Lopez.
Thank you. Yeah,
to Dana's point, this is the CMS guidance about the 30 days. So if you're already required to be compliant by federal guidance, help me understand why it's a problem to codify it in our state law.
So before you came on, Delegate Lopez, I had explained the provision that's in the bill is actually broader than what's in the federal regulations. Well, I should not even, the federal regulations and our current law match, but the interpretation guidelines had that one provision, one sentence about 30 days, but it was qualified by significant change. And unfortunately, the feds did not define what significant change is. So the way this bill is drafted, any change in the notice, no matter how minor, will reset that clock by 30 days. So as I was saying before, if a nursing home will accept a resident in, but the date of that discharge changes, and it could be for a variety of reasons, and I can explain those and even give examples, that 30-day notice resets.
All right.
So this is much more restrictive than the feds.
All right. So why don't we amend this to define significant change as a change in location? Because that is really what the issue at hand is. If you tell someone they're going to a certain location, they start to plan, their family starts making plans, and then it's the significant changes. You're actually sending them to a different facility, which is miles away. That would be a significant change.
And I think the one thing that I would say, and I'm happy to try to tighten that language or modify it, but it is one thing if the accepting, so let's just say it's a nursing facility. So you were supposed to go to nursing facility A, and then they can't take you, but nursing facility B can. If nursing facility B is still in the same geographical location, having to reset that clock another 30 days when
How
it is
about-
similar.
Yeah, I don't mean to cut you off, but I do want to be mindful of the time, and we have to go to subcommittee pretty soon. So if we define significant change and then also add language to say unless agreed upon by the patient, right? Because they might like the change.
The only thing I would caution is, remember, this is an involuntary discharge, so they don't want to leave regardless.
Well, if it's a situation like you described, like, the various points, right? It's not just failure to pay. There's things where they might need more specialized care than that facility can take, right? You might identify a place that has a bed that opens in 2 weeks. We should make it clear that that person can get better care at a different facility in 2 weeks, and that facility doesn't have to try to hold a bed for 2 weeks and lose revenue because this person is beholden to the originating facility for a full 30 days. To me, that seems like the most reasonable compromise that is patient care driven, but also is sensitive to the business needs here.
I understand that, but then that would not be an involuntary discharge. So we're talking about the involuntary discharges where even if it is in the best interest of the resident, for whatever reason, they don't want to leave. So just keep that in mind, but I'm happy to work with you on language that gets to that point.
Is there a way that we can work on that timeline that allows for, I don't want to muddy the waters between voluntary and involuntary, but there are scenarios where a bed is open, they can receive better care, and they can move there. How do we make that happen without crossing into voluntary?
I'd have to take a look at it, but I think that that was one of the main points that I was trying to make before, that instead of trying to put the federal regulations in Maryland law, the federal regulations still exist and have to be complied with. The concern that we have is that the law that's in the bill, or the language in the bill, in our opinion, is inconsistent with federal law. So,
But we can fix that.
right,
I'm gonna
but would it be easier just to let the federal law exist?
Well, I want to, with the indulgence of our subcommittee chair, perhaps have someone from legal aid speak and provide clarification about why this language was included in the originating bill.
And we have about a minute to do that.
Go for it.
Afternoon. This is Viola Willems. I'm the Deputy Advocacy Director for Public Benefits at Maryland Legal Aid. I just wanted to draw the distinction for you between the guidance that's being referenced with the 30-day language in it and a federal law. Currently, that is not a federal law. It's an interpretive guidance that we can't use, to effectively advocate for our residents, for residents of the facilities to remain. Codifying this in Maryland law would provide those protections to our Maryland residents who live in the nursing facilities. And it is particularly important, as Delegate Lopez mentioned, for situations where the facility is changing the discharge location, sometimes at the last minute. And then residents, if they don't have appeal rights anymore, then they're without any recourse as to where they're going next. So I just wanted to put that out there for the committee as well.
Thank you. And it's now 12:59, and so we have, 30 seconds to get to committee. So I'm gonna put a hold on this and ask the three of you to see if we can find some sort of language that's gonna work. And we will come back at it next time around. And again, we will come back to HB 965 in a couple days, because it's the time of year when we get to do subcommittees all day, every day. Thank you for your time, everybody. We'll see you in committee.